Okay, in this video, we'll discuss history taking. So, on the ward rounds, your consultants or your senior doctors will request you to interview patient as a medical student. So, this is just a quick overview of how you can click a patient and the format. Remember, this skill comes with practice. You need to practice more and more for you to be able to click patients in detail. Okay, so the sequence is that the first part, you need to collect the demographics of this patient. This includes the name, the age, the gender, and then you ask the patient they are presenting complaint. What's the main problem they're having? Then you need now to expand on that complaint that you have come with. That's where you have now the development of the history. And then now you're going to review other systems. So as we go on, you see that when taking history, there's a part on which we divide the history according to the body system, the central nervous system, the cardiovascular system, and then we'll progress to taking past medical history and the past surgical history. Then we'll ask about if they're taking any drugs, any allergies. Then we'll progress to family history, then social history, and then we'll summarize everything. Okay, so the introduction is that as a student, you are going to pick a patient, and this is how you're going to approach the patient. You're going to introduce yourself. You tell the patient that, no, my name is Michelle. I would like to ask you some questions about your condition. And then the patient should give consent. That's when you can start interviewing these patients. So now on the demography, you're going to ask the patient's name and age. So name is important for identification of the patient. Age. So one of the importance of age is that there are some certain conditions that are just common in a certain age group. For example, in children, kids, toddlers, diarrhea is very common. So it's important to know the patient's age. Even the gender of the patient, there are some conditions which are common in males, others in females. Then residence, where the patient is staying. There are some places which are prone to waterborne diseases. So with time, you also need to know your area where you're staying as a doctor so that you're familiar with the conditions that are common in there. Then ask about the patient's region, and also in this region, you know, some regions do not eat pork, for example. So that means they are not likely prone to some parasitic infections. Then of course, race, the same thing, tribe, marital status, occupations. So there are some people that have certain occupations that expose them to certain chemicals or environment. So they tend to have certain conditions because of their work. Then also if this patient has been referred or just came straight to the hospital. So there are some instances where the patient came from a clinic, then they come to the hospital. So you're not the first person seeing the patient. Then of course the day of clicking, the informant, if at all there's a patient and the bedsider who are giving you this information, you indicate, and the language of communication that was used. So we move on to the presenting complaint. So on this one, you basically ask the patient. So you start what brings you here, then the patient to explain, I know, doc, I've been having this headache or this cough. So then you inquire for how long. So these are maybe just 3 or 4 things that usually bring patients to the hospital. So they will tell you what they are feeling. Basically, the symptoms that they present with. Under it's a presenting complaint. Some will tell you about diarrhea, running stomach. So you indicate, then ask for how long. So this is how you write the duration. So instead of presenting complaint, so the patient will tell you that they are having a running stomach. They want to get more information about this running stomach. You'd ask them how they were at first. Okay, I know you may have been having a patient that has a history of a running stomach, so it comes and goes. So you ask, how were you before? Patient will tell you, now I was okay. When did you notice this condition? How has it progressed? Is it getting better or worse? You ask them such questions. Then ask them, is it associated with anything else? So sometimes the patient will be having a running stomach, but there's blood in the stool, or maybe they're also vomiting. So remember, each system has got signs and symptoms that it presents with. So as a student, you need to know these signs and symptoms and understand them so that you can ask further on this system in relation to its symptom and system. So this information should be written basically in what the patient is saying. So you're not going to use any medical terms unless the patient has stated. That's when you're going to use any medical terms. So you just write what the patient has said. If the patient was coughing blood, you just indicate coughing blood. If the patient was having a headache, you just say headache. If the patient fainted, say faint. The patient said, I fainted. Avoid medical terminology like syncope, like hematochezia, malena. Just say there's stool, there's blood in stool, there's dark stool in this part. And then you make sure you exhaust the system where these things are coming from. Later on, I'll show you some of the things you can ask in particular systems. And then you also ask, are there any other symptoms that you're having? Sometimes patients will just come in with things that it's their main concern. But as a doctor, you need to ask further so that you can help the patient. And then for pain, you need to secrete the pain. You need to know, to ask the patient the site, the onset, the character, anything that's associated with the pain, anything that's making the pain less painful or more painful. Yeah, that's for pain. For any pain that the patient tells you, you ask this, whether it's headache, that one side of the head is paining, what's causing this pain of the head one side? Is light making it worse? Is being in a dark room making it better? If it's leg on the pain on the leg, you ask if it's where is the pain located, how is the pain, is it a burning pain? So I'll make another video specifically on how you can describe pain. So review of system. So now that the patient came in with stomach pains, that's a GIT, gastrointestinal tract system. But sometimes patients may have other problems in other systems that they think is not a main concern for them. But you, as a medical student, you need to ask these things because you're going to present these things to your bosses or your consultants, your senior doctors, your registrars, and your fellow students. And it's going to help you to catch other problems that the patient is having and help the patient. So in each particular system, there are symptoms that you need to ask that help you to come up with what's wrong with the patient. So in the central nervous system, you can ask about whether the patient has dizziness, blackouts, fainting, loss of balance, numbness. You can ask about involuntary muscle movements, headaches, memory loss. All those are in the central nervous system. You can ask if the patient is having those things. Now, in this section, in the review of system, you're going to write the information in medical terms. So you're going to make sure that you study all the medical terms and what they mean. But as you're asking the patient, you're not going to be asking the patient in medical terminologies, but you're going to translate them in a non-medical English. So you make sure that you study these words and then you tell the patient if they have any of these things. So I'll just run them through quickly. So in the cardiovascular system, you talk about chest pain, you talk about shortness of breath, talk about orthopnea, palpitations. You go to respiratory system, you ask the patient about anything to do with cough, I'll explain more of these things in other videos where I'll be explaining each symptom in relation to the system so that we can have more information on how we can be tracking these patients when they present with these symptoms, in particular systems. For example, a patient comes with cough. You need to make sure I ask you if the cough has sputum, what kind of sputum is it? Is there a pus in sputum? Do they have any fever, any wheezing when they are breathing? You're going to ask all those things. So this video is just a framework of how you're going to be writing these things. But as you're interviewing these people, you need this information in the back of your head. So come to GIT, there are a lot of things you can ask about: vomiting, abdominal pain, difficulty swallowing food, change in appetites, change in bowel movements, any blood in stool or black stool. So in this section, you write the medical terms that as you are seeing them here, but you are going to ask them, the patient, in simple words. For example, in GUT, you're going to ask the patient, is there blood in urine? Not hematuria. Not everyone is familiar with these words, so you're going. So even the doctors on ward rounds, they like this system of asking patients and students what they asked on these particular questions, especially on review of system, because they know students have this system or this habit of just copying the words. So they're going to ask you, what does it mean? And what did the patient say? For example, you tell the patient, you write and present that the patient in the review of system under the GUT, there was no hematuria. Then the doctor will ask you, what is hematuria? You explain. Or they'll ask the patient, did this guy ask you anything to do with blood in urine? They like this system on the ward rounds. Then you progress to musculoskeletal system. So in this review of system, it's just going to be points. It's just going to indicate central nervous system. This was negative, this was positive, this was negative. Headache was positive. Cardiovascular system. And remember that in this review of system, if a system was presented in the history of presenting complaint, you're not going to indicate here. So for example, if only 2 systems were reviewed, so the patient was saying had seizures and also had the chest pains. So you're going to ask these questions in the presenting complaint, and also in the history of presenting complaint. That's why you're going to be focusing this information. But when it comes to review of system, we're going to leave them out because you've already exhausted these things in the history. Then you're going to progress. So this is one area where on the word round, the doctors will ask you questions and make sure you follow this format. If a person comes in with joint pains, difficulties walking, the patient is limping, things like that. So you're dealing with the musculoskeletal system. So you're going to ask all these questions in musculoskeletal system. When you come to review of system, you're not going to mention anything related to musculoskeletal system because you have mentioned them before. Then you're going to talk about these other things and make sure that you know exactly what you're talking about and what you have written. Don't do a copy and paste. If you didn't ask the patient, don't write, because doctors have this tendency of, if you ask something, they also ask the patient. So they'll go, hey, sir, do you have any joint pains? Then the patient will say, no, I don't have any joint pains. But because you did a copy and paste, you just put joint pains positive. So make sure you get the correct information. If you haven't asked, don't write. On past medical history, This is usually straightforward. Just I'm going to ask the patient when last we were admitted. The patient will tell you, no, last month. Then you ask, why were you admitted? For how long were you admitted? So you have those follow-up questions to get more information. It may be that the patient is presenting with the same problem for 3 months ago and today. So if the patient tells you I was admitted last year, for what? Some people tell you, no, I was admitted last year for the same cough. Again, this year I've been admitted 3 times for the same cough. Then you know that there's something wrong with this cough. It's very serious. It keeps on coming back. Say the patient is not compliant with medication or we are not treating it correctly. So you ask why the patient was admitted. Of course, history of similar illness is the same idea. Any chronic conditions that they may have. So sometimes the patient may come with running stomach, but they have other things that they have been having for a long time. So you also list them because it may affect how you manage the patient or see the patient. So you say all these things to your consultant or your registrar or your attending physician on the ward. So on the ward around, they like asking questions about the past medical history of this patient because it may be that the patient is presenting with this for the first time or the condition is getting worse. So the other conditions that you just have to indicate in past medical history. For example, you need to indicate whether the patient is diabetic, has epilepsy, has asthma, has TB, has hypertension. You also ask about their HIV status. Then you also ask about if the patient has sickle cell. So the easiest way of remembering this is using the word deaths. Then past surgical history. This one is very important if you're in surgery, but even in internal medicine, it's also important. So for women, we would want to ask about their cesarean section under this past medical history. So there are some instances where a patient will tell that their cesarean section 2 days ago, and they present with a cough and difficulties in breathing. So it may be maybe the patient has some complications from this C-section that we're having. So for every surgical surgical procedure that the patient has, you need to ask the indication and any complications that he had. Indication simply means the reason why they did that operation on the patient, whether it was a fracture. Then you move to drug history. So you basically ask the patient what medication they are taking. There are some patients that are, for example, hypertensive patients. You ask what kind of medication they are taking. You write the drug they're taking. If they're not able to remember, just indicate they are, say they are on hypertensive drugs. And then you ask about whether they're taking any able medication or they're allergic to anything. Remember on your past medical history. So in some instances, you may want to have a brief history of the patient's, especially women. You would want to know their menstrual periods are they regular or not? Is the flow high or low? Are they on any contraceptives, especially oral contraceptives, because this may cause a deep vein thrombosis, long period of irregular menstruation. Maybe it's very heavy. It may cause anemia in these patients. So you may have a patient who's anemic, but the patient has good diet, is not a sickler, but is anemic, it's not coughing, no fever, no infection, but the patient is just anemic. Then when you ask how your menstrual cycle is very heavy, it may be a reason why the patient is having anemia. So family history, you would like to know how many children the patient has or how many siblings. You ask about list of a similar complaint in the family. So you may find that the whole family is having the same problem because they are exposed to the same things. For example, you may find that, for example, malaria. Malaria usually has this system where one person is infected in the house, within a week or two, another one will start presenting the same symptoms. So you know that, okay, obviously something wrong in the house. Maybe someone comes in vomiting, another family member is also vomiting. You know that, obviously these people ate the same thing, so it's maybe just food poisoning, or maybe their water source is contaminated. And of course, you ask again about the deaths in the family. You ask about is any patient diabetic, epileptic, asthmatic, so of course, in the families, you want to know if any patient is asthmatic, has TB, has hypertension. For example, someone comes in coughing, they are coughing, they have fever. Then you ask, is there anyone in the family with TB? Then they tell you, no, actually, I'm nursing a relative who has tuberculosis. Then you know that it may be one of the reasons why this patient is having this problem. So it's important to have these things. For example, maybe of someone who is, and maybe a quick question on any death in the family, especially unexplained death in the family where a patient, one of the relatives just died without exactly knowing what was the cause. You want to know such information. Or if at all the patient had a similar episode but the patient passed away, maybe, for example, someone would have maybe had a stroke. So you just find the patient that died in the house and they didn't know. So you want to ask such questions. So on social history, want to just get an idea of their social life, because there are some things that cause people to be prone to certain conditions. So you ask their lifestyle. Are they active, or they just usually sit? For example, people work in offices or people travel a lot, especially in planes. They'll tell you that they are having unilateral limb swelling and pain, and they tend to fly a lot. So you would suspect a DVT. Their financial status, the more people have certain money, some certain problems for some reasons don't follow them. Then living conditions, ventilations, the room, respiratory infections, airborne infections are common in houses with maybe a few rooms, poor ventilation. For example, diet. Some people like vegetarians tend to have other conditions that other people are not having because they lack certain nutrients or proteins. People smoke, people consume alcohol. There are some instances where someone are taking a lot of alcohol the day before and is now vomiting blood. So all these things will help you identify a cause of your complaint. Ask about sexual history of recent travel. Then summary, now I'm going to summarize everything you have asked, just to be brief, to include the positives and the negatives, the important things. So in this summary, we are going to use medical terminologies. Since now you are presenting your final evaluation of the whole interview with this patient. So for example, the name you use initials EK, 28-year-old female, RVDR, simply means patient is HIV positive. Then you indicate not on any medication because not patient maybe is not taking medication for some other reasons. Then you continue saying with 3 weeks history of productive cough, 2 weeks history of pleuritic chest pain, occasional hemoptysis with constitutional symptoms, this fever, night sweats, is what they're talking about here. Then with a history of close TB contact. So, for example, the patient is staying with someone who has tuberculosis, you would indicate close contact to someone with TB because it's a risk factor for them to acquiring this infection. Then even the house they're living, so she lives in a two-roomed house with only one window and a lower roof. Then we move on, no palpitations, no pituitary edema, and so on. So in this review of cyst and in this summary, we're just going to pick the positive things you found in the presenting complaint, in the history of presenting complaint, and in the review of system, and some other things that you had picked in the past medical history, surgical history. So you're combining everything, but you're picking out things that are very important that someone would want to know. For example, in surgical history, someone had a woman who had a cesarean section. You may want to indicate here because it may be important in managing this patient. Or for example, someone smokes. You indicate with a 30-year history of smoking. So cigarettes will affect the patient's lungs. Or maybe the patient presented with headache, everything like that, but had very bad body joints pain. You indicate in this because all these things will help you manage the patient and to give a brief idea to someone who hasn't seen the patient when they read this. Or if someone just comes and reads this part, they have a general picture of this patient and how they can manage this patient. So it's not supposed to be very broad, but short, brief, and detailed. So you may say this patient has no cough. So meaning someone will know that now this patient has no cough, but has difficulties in breathing. So difficulties in breathing is positive because you have it, it's present, but cough is negative. So it's an important negative because the patient doesn't have it. So you have stated with a productive cough, or you have said with the shortness of breath, but no cough. So someone who is seeing this patient, okay, this patient is just failing to breathe but has no cough. And then you want now to give a diagnosis of this patient. So from that short summary, you'd say, no, this patient is presenting with tuberculosis in a non-VDR patient, not on medication. So when they